everyone, and welcome to Caring and Living as Neighbors parallel event at the ECOSOC Youth Forum for the United Nations 2025 ECOSOC Youth Forum. My name is Chelvam. I am a first-year student at Lehigh University and a new UN Youth Representative for CLAN. I will be co-hosting this event with Nikki, Katie, and Samiha, my fellow UN Youth Representatives. Now for some housekeeping. Please ensure you are muted if dialing in virtually. Lastly, this event will also be recorded and posted with a report on the CLAN and Mates for Kids websites.
Hello, everyone. My name is Samiha. I'm a first-year student at Lehigh University and a UN Youth Representative for CLAN alongside Tara, Nikki, and Katie, my fellow youth reps. Before we start the event, we would like to acknowledge the traditional owners of the lands that everyone is dialing in from virtually. We invite you to post the traditional lands you're on in the chat now. From Lehigh University in Bethlehem, Pennsylvania of the United States, I acknowledge I am presenting from the lands of the Lenape people, and I pay respect to elders past, present, and emerging. As CLAN is based in Australia, we acknowledge the traditional owners of country throughout Australia and recognize their continuing connection to land, waters, and community. We pay our respect to First Nations peoples internationally and to their cultures and elders, past, present, and future. Now let's talk about the history of CLAN and Lehigh. This event is in partnership with the Lehigh University United Nations Youth Representative Program. The Lehigh Youth Representative Program started in 2008, where high-achieving Lehigh students are matched with UN-accredited NGOs. CLAN is one of 13 NGOs and one of Lehigh's strongest partners. CLAN currently has 4 UN youth representatives, Nikki, Katie, Tara, and myself, Samiha, who advocate for CLAN at United Nations events such as this one. This program allows youth to have a voice in global matters, and in our case, advocacy for children who are living with non-communicable diseases in resource-poor settings.
The 2025 ECOSOC Youth Forum provides a platform for young people to engage in a dialogue with member states and other stakeholders to share their views and concerns, as well as provide actions and recommendations to transform the world into a fairer, greener, and more sustainable place, led by the 2030 Agenda and the Sustainable Development Goals, or SDGs. The ECOSOC Youth Forum will be guided by the 2025 theme of ECOSOC and the High-Level Political Forum, HLPF, Advancing Sustainable, Inclusive, Science and Evidence-Based Solutions for the 2030 Agenda for Sustainable Development and its Sustainable Development Goals for Leaving No One Behind. Youth leaders from around the world will have the opportunity to engage with government representatives, youth delegates, policymakers, and other relevant stakeholders in civil society and the private sector and make their voices heard in advancing their interests and concerns. Our event seeks to highlight youth advocacy and global non-communicable disease efforts. So, what is a non-communicable disease? Our event focuses on non-communicable diseases, otherwise known as chronic diseases or NCDs. NCDs, unlike infectious diseases, are long-term or lifelong health conditions of which cannot be transferred from person to person. They can be a result of factors such as environmental stressors and genetic inheritance. Some examples of NCDs you may have heard of include cancer, diabetes, sickle cell disease, and congenital adrenal hyperplasia, or CAH. Many NCDs can be detected via newborn screening, which includes tests such as pulse oximetry tests and heel prick blood tests. Many NCDs are diagnosable and treatable. However, there are many economic and social factors which can increase preventable morbidity and mortality of children living with NCDs. Therefore, our presenters seek to advocate for education and resources for NCDs to leave no child behind. Now I'd like to introduce to you CLAN. CLAN, short for Caring and Living as Neighbors, is an Australian non-governmental organization founded in 2004 by Dr. Kate Armstrong. CLAN is committed to equity for children living with chronic health conditions in resource-poor settings. CLAN's strategic framework for action focuses on multi-sectoral action on 5 pillars, which include affordable access to medication and equipment, education of the individuals, families, community, health professionals, policymakers, and the international community, optimization of medical management, including primary, secondary, and tertiary prevention with a biopsychosocial focus, encouragement of family support networks, and reducing the financial burdens of families that result in poverty, helping people to become financially independent so they can provide the necessary health care for their children long term. CLAN is focused on promoting equitable access to newborn screening services for all children of the world, as it supports early diagnosis and treatment of many chronic conditions of childhood that are associated with preventable morbidity and mortality. Special efforts are going to be needed to reach babies from resource-poor settings and families. A rights-based approach is at the core of CLAN's mission to support children living with non-communicable diseases, NCDs, and other chronic health conditions. This approach recognizes that all children, regardless of their health status, have the right to the highest attainable standard of health, as outlined in the United Nations Convention on the Rights of Child, CRC, and other human rights framework. I'd now like to introduce Nikki Pasterczyk, a United Nations youth representative for CLAN. She will be speaking on the great work youth at the forefront of NCDs are going to drive change.
Thank you so much, Tara. I really appreciate it. So like they said, I am part of the UN Youth Representative team for CLAN. I've been doing this for quite some time now, since 2022, and I'm coming at a close here at 2025 as I'm graduating from Lehigh. So I'm obtaining my bachelor's degree in molecular biology, and a lot of what I study is inspired by my brother's NCD. My brother has phenylketonuria, or PKU. And so essentially he doesn't have the best ability to break down one of our amino acids, phenylalanine. So I'm very much an advocate for newborn screening and all NCD efforts. So I'll share some of the great work I've been involved in as part of CLAN, as well as other youth advocates in CLAN. All right, so one of the main topics I'll be discussing is the Lehigh UN partnership. So this is something that was founded in 2008, and I would attribute most of the work towards Dr. Bill Hunter, which is an amazing person at Lehigh University, really advocating for youth and international education. And he sort of founded this collaboration with the United Nations to get actual university students to partner with NGOs and actually represent them at the United Nations. So that's an incredible feat in and of itself. And CLAN was one of the NGOs that was part of this partnership pretty early on. So there's lots of different youth reps for different organizations, whether that's more environmental or health-based, human rights, so on and so forth. But obviously here we're focused on NCDs here at CLAN. Some of the roles that some of us youth reps do through CLAN include writing published UN statements and reports on behalf of CLAN. So for instance, the Commission on the Status of Women, the Commission for Social Development, they always have annual opportunities to publish written statements for the NGO in relation to that commission's theme for the year. So sometimes we focus on newborn screening. Sometimes we talk about mothers who are affected caring by NCDs. We cater to these themes, and we're able to hit different topics relating to NCDs. What you're seeing here today is an organization and hosting of CLAN's virtual presentations. So given the fact that CLAN has such a large global network, we do a lot of virtual UN affiliated events, just because, you know, these NCDs don't happen in isolation, and it's very hard to host these events just at the UN headquarters to get the greatest impact possible. So part of our role as UN youth reps is to do so. And then also, whenever we need to, we do attend and present at the UN conferences at the New York City headquarters. So this is really great because CLAN is based in Australia, and it is not the best, both economically and environmentally, to probably be flying over to New York City whenever there is a great event going on at the UN or ability to speak. So that sort of lessens the burden for them to have us university students, which on a good day, with not much traffic, maybe only 2 hours or so from New York City of a drive for us. So we go ahead and do that. And then the reason why we can even access the UN headquarters is because we're granted badges to the headquarters due to CLAN's great ECOSOC accreditation. And then part of our role as UN Youth Reps is to write up a lot of social media work and reports. So sort of what you can see in the middle here is an example of how we promote our events. Maybe you saw some of our social media tiles floating around, and that's why you registered for this event. We also provide a lot of educational materials. So what you see in the top right is something that I made for International Neonatal Screening Day to get the word out more about why newborn screening is so incredibly essential to diagnose these NCDs. Also, following this event, I'm sure you'll want to know more and want to get a recap of everything. So we will have an official event report for this event, as we do for all of our other ones. And this is really great because not everyone can meet us at these times, especially if we're doing global events. So you can always get a recap of our events there. And then, like I said earlier, we do a lot of official statements for UN publishing. So whether that be the Commission of Status of Women, Commission of Social Development, and I've been involved on very many of those over the past 3 years or so. And fortunately, they've been able to accept them each time. So outside of documents, we do quite a few events. So this is a virtual event, but not all of them are. We actually did a hybrid event in 2023 for the Commission of Status of Women. So that year we focused a lot on newborn screening. And there, in the picture in the middle, I'm there with one of our former youth reps, Sophia, and actually some of our youth advisors from CLAN from Australia. And they actually flew over and helped us present the event and organize it all. So that was really amazing. We were able to present our event on newborn screening at the Church Center for the United Nations. And then our youth advisors were able to attend some of the Commission of the Status of Women events that following week. So that was one of our hybrid events, but again, to get the most impact possible and to be involved in a whole variety of events, we do mainly virtual ones. So last year was packed. We had Science Summit, World Health Assembly, Commission on Status of Women, Commission for Social Development. I mean, there's probably more. We definitely keep ourselves busy and definitely help to get the word out, especially because each of these events have different themes, and we're able to voice lots of different perspectives on NCDs, whether that be like a gender perspective or a science perspective, and so on and so forth. And then another great opportunity through this partnership, especially because CLAN is ECOSOC accredited, is the ability to actually go ahead and make oral statements at the UN. So fortunately, I've been able to be accepted to do this a few times for the Commission of Status of Women and the Commission for Social Development. So I will go ahead and make statements. Previously, I mainly focused on newborn screening, given the fact that I personally resonate with it with my brother's diagnosis. So you can see a screenshot there from UNTV when I was at the Commission for Social Development the other year. And then fortunately, we get a lot of exposure through our involvement. For instance, the United Nations Academic Impact reached out to us during our CSW in 2023 and asked asked Sophia and I, our former youth rep, to go ahead and speak about why it's so important for youth to be involved in these advocacy efforts. And so it was really great to disseminate that to another audience outside of our organized CLAN events there. And so again, this is really great because as someone who's, I'm 21 years old, but at the time I was making these statements, being only 19, 20 years old. I mean, it was an incredible opportunity, and I am really privileged to do so and represent Clan in this way, but also to inspire other youth advocates to go to the UN and make their own personal efforts heard. So I talk a lot about the global work that Clan does with youth advocacy, but they do a lot of local efforts as well. Clan was actually a really great part of founding NCD Child. They were the founding secretary, and NCD Child, I'm sure if you're in at all in the NCD community, you hear about all their great efforts, and they actually do enlist and they do enlist youth advisors for the NGO. And then Clan itself actually has its own youth advisors. You saw in that earlier picture with Grace and Sienna from our CSW event from a couple years ago. They do more local work, but I guess it's some sample work that they've contributed to the NGO as well. It are the Great Clan's Child Friendly Rights Flyers. So these educate lots of different NCD communities on what their NCD is, how it can be treated, what resources they have, what rights that they have, especially because education is a huge issue in NCDs, and really just understanding it as a whole and what they are entitled to and for their conditions. And they definitely put the extra work in by not only going across a wide variety of NCDs, but also disseminating this across different languages and for particular communities that might be affected more by certain NCDs. Like for instance, you see English, Swahili, Korean, Spanish, a whole variety of languages. So it's not centered on just a few countries. And so that this information is accessible to all. So we really appreciate the role these youth advisors play in creating materials such as this. And so the involvement doesn't just start at Clan. I mean, Clan is actually great because Clan is sort of like an incubator to make youth into these incredible models for your NCD advocacy. We have lots of great former youth representatives. Here I just would like to highlight Nadine and Emma. So Nadine I've actually met in person once or twice, and she's an incredible woman doing a lot of health-based work now, but she took her role from just being a UN youth representative into going into more into the World Health Assembly. She served as a youth chair on the NGO DPI Executive Committee at the UN. She served as director on the UN NGO Executive Committee, and to my understanding, I believe she was the youngest person to have ever served in that role at the time. And she co-authored the 2019 Global Youth Climate Action Declaration as well. And so there's also Emma, who I came in after Emma was finishing up with her time at Lehigh. And so she expanded her work into also becoming a Mates for Kids project officer. And then she also had the incredible honor of being selected as a Boren Scholar, which provides funding to immerse in cultures and learn a language that the United States sees as very important or emergent. So in that case, she went to Indonesia and learned language there. And what was really great about that is that she was able to use that educational opportunity and her experience with Clan advocating for NCDs and actually act as a project support officer for the International Pediatric Association, or IPA. And so she was working in Indonesia there, again, working on NCD efforts. So Clan has definitely made sure not to focus NCD efforts just that as your time serving as a UN youth rep, but to expand that into your career. And not to have that happen in isolation. And then as for the current work that's being done, so currently I'm at the moment of spearheading a collaborative effort on a co-design journal manuscript highlighting youth engagement in NCDs. So as you'll see by some of the presenters here today, this article will be discussing youth advocacy in lots of different perspectives and different NGOs. In the case of CLAN, we do a lot of work for the particular NCD CAH. However, that is not the only NCD, and there's lots of other ones, such as sickle cell, cancer, diabetes, so on and so forth. And so we really want to put the spotlight of youth advocacy from different perspectives, because there are certain themes that we see in each of these NGOs, like what is working in terms of youth advocacy, and places for improvement that we see where youth could have a greater role but don't, or what other gaps there are to fill in order to contribute to the Sustainable Development Goals. So definitely keep an eye out for that. That's in progress. If you're interested in collaborating, please let us know. But this paper is really supposed to fire us up and act as a platform for the UN high-level meeting on NCDs in September 25, which is a huge event. These NCD events don't come around too often, so we really want to bring this youth advocacy lens on NCDs as boldly as possible. Yeah, so that's all for me. I really appreciate you all listening in. And again, I'm really happy to speak on behalf of all the great work of CLAN. And it's a privilege to be involved as a youth rep. And it's sad to see my time is closing, but I really hope to be further involved in these NCD efforts.
Thank you so much, Nikki. Now, I would like to introduce Leah Kilenga, founder and CEO of Africa Sickle Cell Organization.
Hi, everyone. Thank you so much for the introduction. And I'm really excited to be here. And thank you, Nikki, for giving us a foundation in which to build on. Okay. So one thing that is not in my bio is that I'm a young person living with sickle cell disease, leading an organization that is main mission is solving sickle cell disease in sub-Saharan Africa. So this presentation today is going to give you a background of what sickle cell is. Fun fact, we have a funder from Australia who struggled last year to really raise resources for sickle cell in sub-Saharan Africa for us because of the lack of awareness. So this platform really elevates the issue. Secondly, I'm going to look at the work that we are doing as Africa Sickle Cell Organization, our model, and third, our interventions that engage youth, especially for our sickle cell work and the recommendations we have. So keep posted. I hope there are questions at the end, and looking forward to the other panelists and to sharing what I have. So sickle cell disease is the most common genetic blood condition globally. It came to be, it has been in existence for over 100 years, but the advancements in research, in healthcare, in access to medicines, or even the different therapies does not reflect the age of sickle cell disease. And so for a person living with sickle cell, like myself, our red blood cells are not normal and round. They are sickle-shaped like this. So this means that there's limited oxygen carrying capacity. They're stiff, rigid, and fragile, and they usually block the small capillaries, preventing oxygen flow in the major organs. And these sickle cells are not as durable. They last between 10 to 20 days, whilst the normal red blood cells last for 120 days. So there is severe anemia and low hemoglobin amongst people living with sickle cell disease. So this physiology usually leads to multiple complications, because if blood is life and it's moving through your body and is connected to all organs, this means that sickle cell is a multi-organ disease, which affects your neurocognitive abilities, your optical abilities, your immune system, your cardiovascular, pulmonary system, reproductive system, your orthopedic system, if that's a system, your liver, your spleen, your renal functions, your psychological, psychosocial functions. And so it is multi-organ, multi-level condition that can only be addressed from a clinical point and also a psychosocial and mental point. So this leads to a lot of mortalities in sub-Saharan Africa. So next slide. So the realities of sickle cell, like in terms of statistics, close to 515,000 people are born, or children are born with sickle cell disease globally. And this is an estimation because a lot of the data in sub-Saharan Africa and areas where sickle cell is highly burdened do not have data gathering systems. So this is an approximation and an estimation, which is an underestimation of exactly what is within our countries. But of this number, 70% of them occur in sub-Saharan Africa. And in Kenya specifically, they're estimated to be 14,000 newborns with sickle cell each year born. But the sad fact is that our health systems with sickle cell in sub-Saharan Africa are very underdeveloped, that we are still seeing up to 90% of mortalities for children below the age of 5. So out of 1,000 children that are born, let's say every day in sub-Saharan Africa, majority do not make it to their 5th birthday. And if they make it, if they live through their adulthood and their adolescence, they lose up to 50 years of healthy life through preventable complications, disabilities, and eventual death. So Africa Sickle Cell Organization identified a problem. And one of the biggest problems, not only for Kenya, but for sub-Saharan Africa, is there's an overwhelming majority of people living with sickle cell disease in Kenya that do not have access to comprehensive, timely, quality, affordable diagnosis, clinical management, and patient care. So this is how we solve it. So we have realized that in sub-Saharan Africa, especially multiple countries, healthcare is devolved, like let's say the United States. There's the national government, and then there's the county governments or the sub-national governments. So what Africa Sickle Cell does is we partner and co-create sub-national sickle cell programs in high-burden communities. So these sub-national programs focus on 3 areas. 1, to ensure that there's early, continuous access to care at the inpatient and outpatient level from primary across the tertiary levels within public facilities within Kenya and within those communities. Secondly, we cover these families with a health financing and health insurance coverage so that they can be able to afford access to care. A lot of this care within sub-Saharan Africa is not covered in national health insurance or any insurance, meaning that they have to spend incredible amounts of out-of-pocket expenses to be able to reach to points of care, to be able to afford this care, and to be able to get the management that they need. And then third, we address the sickle cell livelihoods. So we have realized that even though there's the basic of care, even though we are paying for this care, there's still families and there's still people living with sickle cell who have low or very poor social economic outcomes because of their living situations, that we have to support them so that we can be able to get the optimal health outcomes that we desire. So we address the social determinants of health by supporting the livelihoods of these patients and their families. And of course, all this comes together with advocacy and awareness that continues throughout to ensure there's continued prioritization and education within communities. Okay. So what we realized, again, So a lot of the interventions in sub-Saharan Africa, I'm sorry to say this, but is heavily focused on the statistics that I mentioned earlier, that's under 5 mortality rates. How are we reducing the mortality rates of children between 0 to 5? So a lot of interventions are focused on newborn screening, linkage to care, access to essential medicines, which is very, very important. However, once this stage is passed, very few programs are addressing adolescents and young adults. And we have realized that as much as we are working across different age groups, we are seeing more mortalities happen now within our programs, especially in the areas that ASCO operates in, that the mortalities and the morbidities are happening around the adolescent and the young adult phase. And one of the reasons is because a lot of these people live in low economic areas, and they missed a lot of school days, so they are not employable. They did not finish school, so there's a cycle of poverty that they are living through that they require some sort of support to get from. So we have been doing this informally. The Sickle Cell Livelihood Fund has been running informally for a very long time because we were figuring out how can we sustainably provide them with an income or an income generating opportunity that can be able to sustain their ability to make money to sustain their lives. So we'll be launching the Livelihood Fund, although it has been running, that targets basic needs, meaning what access to foods, access to clean water, access to transport to get care or to receive care, and educational grants. Because a lot of the young people are now surviving from the age of being a child to now being an adolescent or a young adult. They want to go back to school, but they do not have money to go to school. So we are giving them educational grants to be able to allow them to further their education wherever they stopped it. The second thing that we are doing is Africa Sickle Cell Organization has partnered with the Sickle Cell Federation of Kenya. We are nurturing champions across the country, meaning for someone like myself living with sickle cell, there's not much energy to go around. Like I cannot do the advocacy required for the entire continent. So how do I decentralize the knowledge that I have gained through the years of being an advocate to other advocates at the grassroots level? Because healthcare and decision-making has been decentralized, how can we have patient advocates at the grassroots level to be able to advocate for themselves so that they can be prioritized within their communities? So we have a knowledge exchange program that has identified passionate, healthy, inspired patients or people living with sickle cell, young people, to be able to give them this knowledge to be able to do the work within their communities. Third, we have partnered with an organization from the United States called Generation Patient. They're a youth-led, patient-led organization that serving young people with chronic medical conditions. So they have, since COVID to now, they have run 600 peer support groups virtually. So now they're going global, and because we are a very, very close partner, they are supporting us to do the East African peer support groups for young adults with non-communicable diseases, to have a space and tools to be able to navigate life and the resources to be able to navigate life with the nuances of living with a chronic condition, okay? The fourth thing is Africa Sickle Cell Organization sits at the World Coalition of Sickle Cell Disease. And with the World Coalition, we have developed a position statement that calls for the inclusion of young people, of adolescents, and sickle cell in the political declaration of the 2025 UN high-level meeting on NCDs. So we are happy that even though sickle cell is not mentioned in the prioritization of the larger NCD group, we will have its mention through this inclusion of youth and adolescents and sickle cell within this position statement. It is the first ever of its kind for sickle cell. Since ever. So this is a really, really big thing for us. And we're really, really excited about the meeting in September. And lastly, we are working on a consistent statement on young people. So I don't know how many of you have realized that there's no really proper definition of young people. They usually group all young people under the age of 65 with a big clump between 18 and 65. So that removes a lot of nuance of the age development categorizations and the transition that is required as we develop physiologically, biologically, neurologically across the different life stages. So with regards to research, with regards to age-appropriate care, it's very difficult, especially for these chronic conditions that are, let's say, not the big ones, for us to get appropriate care. So we have partnered with other patient-led organizations to create a consistent statement that allows the WHO and other global health organizations to have an aggregate definition of what they mean by young people. Is it 18 to 35? Is it 35 to, give us the definitions that it is easier for care to be dispensed to people like us. So those are the 5 ways we are doing it. It's multi-level, it's multi-stakeholders, and it's cross-border. So we are looking at the different levels where people and young people with sickle cell are affected, and we're trying to engage them at those different levels. So what are my recommendations? Well, one of the biggest recommendations for me that really irritates me is that sickle cell being the most common genetic blood condition to date, with affecting close to 2 million people, and it's still something that is not really discussed. It's still something that we need to really addressed in closed doors. It's still something that we really need to struggle to resource for. For me, we're in 2025, and NCDs go beyond cardiovascular diseases, cancers, diabetes, mental health conditions, chronic obstructive pulmonary diseases. We have smaller non-communicable diseases that need to be prioritized. And I think for preventative, the best way for this chronic congenital conditions is the preventative approach that CLAN is really advocating for, with the newborn screening programs and the education within communities. Second thing is I know we've made great strides in the meaningful involvement of people living with non-communicable diseases, leading and including them in the NCD prioritization and in the advocacy efforts, but we need to go a step further and now empower young people with these chronic conditions to empower and to lead this NCD advocacy. And how do we empower them? By resourcing them. A lot of the youth movements are never resourced. Young people are never trusted with money for some reason, because we don't know how to use money, which is a lie. But if you get out of the way, we can be able to do things, and we can be able to co-create and come together to lead the NCD movement the way we feel will serve us best and serve our communities best. The third thing is enhancing research. Research within young people. I think young people is a demographic that usually falls through the cracks. And I don't know why. It's like once you get beyond the age that is critical, that is under 5 or childhood, then it becomes like you can fend for yourself. I don't think so. I really don't think so. We need to strengthen the definitions of what a young person is, what a youth is. Secondly, we need to look at proven interventions like peer support. It's very, very effective in terms of coping mechanisms, in terms of adherence, in terms of being able to navigate life with a chronic condition. And there's not a lot of literature on this, and not a lot of research, and not a lot of research that is including the right demographics of young people. So that is my third recommendation. The last one is, of course, financing. Financing, especially for youth NCDs. There's a lot of financial shifts that have happened recently, especially with the US changing its its administrative priorities. And a lot of conversation is circling around NCDs, but there's really nothing we are hearing about youth NCDs. So how do we ensure that when we're having this conversation of health financing, that youth are being considered? So thank you very much. That's my presentation. Back to you, Samiha.
Thank you so much for speaking on behalf of your incredible work, Leah. We would now like to introduce the youth-led Sickle Ed team from Lehigh University to also speak on their advancement of sickle cell disease efforts.
Hey, thank you, Nicole, and the Lehigh University UN representatives for inviting Sickle Ed to be a part of the forum today. And we are honored to be here with the 4 of our members on our team to share what our group has been working on. So to give everyone a brief introduction, our team is a project at Lehigh University, developing a strategy to integrate diagnostic test strips, continuing medical education courses, outreach materials, and policy initiatives. Our project studies the impact of diagnosis on patient outcomes, perceptions of sickle cell disease, education for healthcare providers, and the public and international policy. The ultimate goal is to create an accessible patient-centered system for diagnosing and managing the sickle cell disease in Sierra Leone. So my name is Sarah, and I am a chemical engineering major. I'm currently a sophomore, and I am mostly in the outreach and education part of our project.
I'm River. I'm a sophomore on the team and a bioengineering student here, and I'm more focused on the lab and test strip part of our project.
I'm
Hello.
Will. I'm a freshman bioengineering major, and I'm more focused on the lab and the test strip.
Hello, everyone. I'm Prashant. I'm a biostatistics and health data science major here in Lehigh. And I'm also focused in both the diagnostic and education part of our project.
To the next slide, please. Okay, and the next slide, please. So we work closely with both in-country and international partners to develop our diagnostic device and education communities about sickle cell disease. So on to the next slide. What is the sickle cell disease? Leah did cover a lot about the sickle cell disease, but the sickle cell disease is a common genetic condition that affects multiple body systems and impairs normal function. So it arises from an abnormal variant of hemoglobin in the blood system. And this hemoglobin is a protein in red blood cells that carries oxygen throughout the body. So normally, blood cells have a donut shape, but however, the sickle cell causes red blood cells to adopt a sickle conformation, and this causes the clump and inhibits circulation in our body. So on to the next slide. According to the CDC, this disease can result in a number of painful complications. So this can cause acute chest syndrome, bone damage, organ damage, blood clots, stroke, kidney damage, and it also increases risk of infections and fevers that usually begin in early childhood. So what is the perception of the sickle cell disease like in sub-Saharan Africa? Although the awareness of the disease is relatively high in sub-Saharan Africa, there are still significant gaps in understanding the disease. So, for example, a study conducted in Nigeria among secondary school students found that 97.4% were aware of the sickle cell disease, but only 44.5% could name one symptom for the disease, and only 1.4% knew that a blood test is used for diagnosis. So in Sierra Leone, misconceptions about the disease remain widespread. A 2020 study found that mothers were often blamed when a child was born with the sickle cell disease, while fathers were seen as less responsible, even though the disease has to be inherited by both parents. Additionally, some communities believe that the sickle cell disease is caused by witchcraft and curses from the ancestors because they have committed something wrong in their past lives. They also believe the disease can be treated with herbal medicine, despite a lack of scientific evidence supporting these beliefs. On to the next slide. The sickle cell disease is also more common to find in countries where the malaria disease is present. So if a mosquito carrying the malaria germ bites someone with the sickle cell trait, the person isn't as likely to get as sick as other people. That's because people with the sickle cell trait have red blood cells that make it hard for the malaria germ to grow. So scientists believe that as Africa's population evolved, those without a single mutation would often die of malaria. And those who had two copies of the gene would die of sickle cell disease. That's why the single mutation became extremely common in Africa as the population settled and expanded, and this is why it is more common in sub-Saharan Africa than countries like the United States. So passing on the presentation to River.
All right, so like Sarah said, sickle cell disease is very prevalent in sub-Saharan Africa because it provides some resistance to malaria. So this high concentration, these very high numbers of the disease in these countries is already a problem itself, but the problem is really intensified when we take into consideration that there's just such a lack of sickle cell disease understanding, awareness, accessibility to diagnosis and treatment. So to understand the true scope of this problem, I have some statistics here, which Leah actually already has a bunch of these. And something that's funny that I noticed is that I believe on her side, it mentioned that there was about 500,000 cases of sickle cell disease a year. Now, from what I found, I saw numbers saying that it was about 300,000 cases. And I think this really points to the problem that there's the majority of cases of sickle cell disease, it's upwards to about 80% are located in Africa. However, since there is so much, such a lack of diagnosis, it's impossible to really understand how many people are affected with it and what the diagnosed population is. And like she said again, anywhere from 50 to 90% of children who are born with sickle cell disease are expected to die before their 5th birthday. And another small study was conducted in Sierra Leone that showed out of a small group, only about 24% of babies were tested for sickle cell disease at birth. Now, compare this to other countries such as the United States, where is regulation and nearly 100% of babies they're all tested for sickle cell disease at birth. So sickle cell disease, despite these numbers of so many children dying at such a young age, it is not necessarily a deadly disease, and it is very much treatable. With access to proper treatment, such as medications and blood transfusions, people are expected to live relatively healthy lifestyles up to their mid-50s, such as in the United States, the average lifespan is about 53. However, in countries like Sierra Leone, which is where we're working, they aren't diagnosed at birth, they don't recognize the symptoms of the disease, so therefore they aren't taking medications, they're not getting the blood transfusions that they need to treat this disease. Okay, on to Prashant.
As you know, our team name is Sickle Ed. So the Sickle Ed name has its own meaning. So you can see ED at the end. E stands for education and D for diagnosis. And for education, we're trying to make the healthcare providers and people educated and aware about the sickle cell disease, and we're trying to eradicate the stigma based on the sickle cell disease. And talking about diagnosis, we're working on developing a point of care diagnostic device, a test strip that can be used to diagnose sickle cell disease. We can just pour a little drop of blood and know if we have sickle cell disease or not. Moving on to the next slide. Is it stuck for me or like is it stuck for everyone?
It's stuck for me too.
It's stuck for me. Okay.
Hello, everyone. Sorry about that. I think something must have happened to Nikki's internet.
Yes, it did go out for a second. Sorry about that. Let me share this again.
So while we're talking about diagnostic devices, I want to talk about current diagnosis, like the diagnostic devices available. So looking like if you look at the current most advanced device, the high performance liquid chromatography is the gold standard test, like the diagnostic device for sickle cell disease. But like if you look at the current diagnostic text available in Sierra Leone, then it is the sickling tests which are available in the peripheral health unit or the nearby clinic or labs. And another device that you see here is the hemoglobin electrophoresis device, which is also one of the most accurate device that can diagnose sickle cell disease. But this device is only available in Freetown, Sierra Leone, which is the capital city of Sierra Leone, and the accessibility to diagnosis is very limited outside of the cities, and it makes it really hard for diagnosis and like the early treatment of sickle cell disease. So passing it again to River.
Okay, so what we are working on is an accessible solution for diagnosis. So what we are making, it's very simple compared to the tests that Prashant was talking about, like electrophoresis or liquid chromatography tests. These kinds of tests they may not take that long to do, but they require lab technicians or doctors, and it might take them a few days to get around to, analyzing and interpreting these results, and then by the time the patient gets their results back, it takes a long period of time. So what we are working on is a test strip that is very similar to just an at-home at-home COVID test or a pregnancy test. So when this test is fully developed, the person taking the test simply just needs to poke themselves with a small prick, and then they will apply the drop of blood to the test strip. And then they're just going to have to put a solution on top of the blood, and that's going to allow the blood to flow up the test. And eventually the test it has 3 lines, and then depending on what kind of hemoglobin is present in your blood, it will give you your results, and it will show a few blue lines. So well, again, once it's fully developed, we plan to have instructions in this test as well, so people can interpret their results as well as be directed towards treatment or further testing to determine and clarify if they truly are tested positive for sickle cell disease. And then on to the next slide. All right. So currently what we are doing in lab is we are working on improving the consistency and intensity of the blue test strip lines. So something that has been taking us a while for developing this test, we're just a group of college students, and we hand assemble every single one of these tests. It is a lot of very complicated science, and since we are making these by hand, every time we make them, it's not always the most consistent results. Another problem is that since sickle cell disease is primarily located in Africa, we have a lot of difficulty accessing blood that has the HbS or the sickle cell hemoglobin in it. which makes it a little difficult to test how our diagnostic test works with this kind of blood. However, though, we are currently partnered with the Lehigh Valley Health Network Hospital. So before we partnered with them, we were testing our strips using fake blood. So it was just a solution mixed with HbA, which is the normal hemoglobin that is found in your blood. However, now that we're working with the hospital, we get weekly blood samples and we're able to actually run and see how our tests are working every week with real blood, similar to how they're going to work in real life. On top of this, we are also partnered with OraSure, which is a test manufacturing company that's just located about 5 minutes away from us. Just the other day, they were actually able to produce 490 test strips for us. So before we got these tests printed by them, our test lines, they weren't actually lines. We were applying small drops of antibodies. So our test results would be dots and they weren't always the most consistent. But now these test results will show up as crisp blue lines, just like in this picture here, which is what we intend to do in the future. This is unrelated to our test, but some other exciting news on what our project is doing. One of our older team members, a few years ago, she traveled to Sierra Leone for 3 weeks over the summer, and she conducted some surveys with some different populations in Sierra Leone, such as just everyday people, doctors, pharmacists, PHU, which is it's a peripheral health unit. She spoke with all of these people and got an understanding of what the education and perception of sickle cell disease is like in their communities, and she is actually awaiting publication on a research paper. And then over this summer, we are actually going to have 4 team members working full-time over the summer to continue researching and proving this test device and working closely with OraSure to get these tests manufactured so they are more accurate and consistent. I probably should have had this earlier on in the presentation, but for a little overview of how our test works. So what it does is it uses antibodies to bind to the different kinds of hemoglobin that is in your blood. So to break it down as simple as possible, on the very left side, there's something called a sample pad. This is where the person who is doing the test is going to apply their blood. Then the blood will flow into what is called a conjugate pad, and the blood is going to bind to these beads that have antibodies on them. So depending on if you have HbA, which is normal hemoglobin, or HbS, it will bind to those specific antibodies. And then they will travel up to those 3 lines. And it will also, again, it's going to bind to those specific test lines, depending on what kind of hemoglobin you have. And then what gives you the results binded to these antibodies are these little blue beads. So once they're at their final state and they're binded at these test lines, that's what's going to give you your blue test line results. I hope that was a good explanation.
As Prashant mentioned before, SickleEd is more than just a diagnostic device. We're also looking to spread education and awareness surrounding sickle cell disease in Sierra Leone to hopefully combat the stigma and the misconceptions surrounding the disease. Next slide, please. To do that, we've created posters that we've already distributed to 95 peripheral health units. These posters will be hung in these PHUs for the patients to learn more about the sickle cell disease and how to manage it, and will hopefully last at these PHUs for years to come. Next slide. And similar to the posters, we're also working with the Ministry of Education to develop flipbooks. We would like to work with local artists to create these flipbooks with images that better resonate with the Sierra Leonean population. But shown on the screen are some of the initial prototypes we have for our flipbook. Now, something that is currently in progress is our continuing medical education course, or CME. our online CME course would help healthcare providers further their education regarding the sickle cell disease with a universal standard of testing. So the course would include videos and readings that would be tested with assessments, and then if they score a high enough score, the healthcare providers would earn a certificate. Our CME is currently in its early stages, and we would like to work with partners in health as they're currently working on something similar. And the way our CME would ideally be implemented is with the yearly in-person training workshops that are already held for malaria education. And another project we are currently working on is creating a standard operating procedure for Sierra Leone. An SOP is a detailed outline for caregivers to reference to know what steps to take during diagnosis and treatment. The current SOP for sickle cell disease in Sierra Leone is just 3 pages long, with very general and not very applicable information for most Sierra Leoneans, as they might not have the means to get the recommended drugs to treat the disease or the means to get to a diagnosis site. When compared to Kenya, who has a 52-page SOP just dedicated to sickle cell disease, the difference is night and day. Our objective over the summer is to develop a detailed SOP for sickle cell disease that is comparable to those of countries like Kenya. For our future plans, right now in spring of 2025, we're working hard in the lab to optimize our device, working with our partners and preparing for plans for over the summer. Then over the summer, 4 of our members will be working on the project full-time to optimize the device as good as possible before traveling to Sierra Leone for fieldwork. During fieldwork, we're going to be implementing our educational materials, working with our partners that are in country, and also test our device with people with real blood from the people in Sierra Leone. And then next spring, hopefully, we'll be having a fully complete device where we could finally start manufacturing at a larger scale and looking for government approval. And then further down the road, we plan on handing our project off to manufacturers or manufacturing partners in country to further develop the development of the device, and then also expanding the project scope to other countries that may have problems with sickle cell disease. So thank you for listening. Please scan the QR code to stay connected with us.
Thank you so much to the Sickle Ed team for their amazing education and innovation towards sickle cell disease. I would now like to introduce Angela Castro, an incredible CAH youth advocate from Colombia.
Yes, I'm sorry. Hello, everyone. My name is Angela Castro, and I have the honor of sharing with you the historic and impact of CH joining forces in Colombia. Throughout this presentation, I want to take off a journey of how this initiative was born, the work we do, and the positive changes we have experienced. Next slide, please. Our community CH joining forces Colombia. Next slide, please. My name is Angela Castro. I am 18 years old. I study business administration and I have CH. Beyond my academic pursuits and passionate about the fashion, and I have clothing brand called by Angela Castro, whose mission is to inspire and motivate people through fashion. I also like to shoot videos and connect people in this way. Next, please. Now, let's talk about this wonderful community started. How was this community born? This community was born out of the need for support and connection among the patients and caregivers with CEH. It all started with a special meeting. We are realized that having a dedicated special to share experience and challenges would be invaluable. Thanks to the encouragement of the Siendo Foundation, for amazing mothers took the initiatives and lead the projects we love, committed and strong, desired to make difference. Who are we? We proud to be the first CH community in Colombia. Our mission is to provide support, share knowledge, and grow together, creating a strong network that improves our quality of life. This network fosters collaboration, ensuring that everyone has access to resources and guidance we need. Next, please. What do we do? Our community is committed to creating learning spaces that creating to knowledge by patients and caregivers. We actively listen to concerns, identity challenges, and develop effective support strategies. In addition, we work tirelessly to strengthen within our community, ensuring no one feels alone in the journey. I'm sorry. Our community is next, please. Our progress. Through our collective efforts, we have made significant progress. We have created an online library, deployment to printable resources, an emergency protocol, and medical recommendations. We have conducting virtual training sessions with expert recording team and make the team accessible on social media. We advocate for people who are gaining servers and partner with the other foundations to assist the team. We create an emotional support spaces when affiliates can share their experience and develop coping strategies. And we coordinated a special ed course with the National University of Colombia called Learning to Cover Caregiver for people with chronic illnesses. Next, please. How has this changed my life? Before discovering this community, I felt was the only person with CH. This discouraged me as I had never met anyone who understood and shared my condition. However, everything challenge I became part of the initiative, connecting with others who are similar experiences has been truly transformative. Not only have I learned a lot, but being a learner in this community has given me a sense of empowerment and happiness. And I now realize the importance of collective support and incredible impact we can have when stand together. As we conceive to grow, we invite everyone to join us in this mission. If you want to learn more and invite you connect with us at social media. Together we are stronger and truly united. We create a better future for everyone in the CH community. Thank you for your time.
Thank you so much for sharing your great work, Angela. I would now like to introduce Project Officer for Mates for Kids, Dune Barot, to speak on behalf of the great youth work, NCD work of Mates for Kids.
Thank you for the introduction. Hello, everyone. My name is Tun Barot. I'm a third-year undergraduate student studying public health and systems management at University of North Carolina at Charlotte. I'm excited to be joining as the new project officer for Mates for Kids, and today I'll be sharing some of the youth engagement work that Mates for Kids is doing. Next slide, please. So I'd like to start with a quick overview of Mates for Kids for those unfamiliar with our work. Children with congenital adrenal hyperplasia, or CAH, in countries like Australia have long benefited from reliable access to essential medicines like hydrocortisone and fludrocortisone. This access has dramatically improved their health outcomes and quality of life, but in many low and middle income countries, these medicines are still unavailable for unaffordable, leading to preventable illnesses and even death. Mates for Kids is a global coalition working to change that. We collaborate to improve access to essential medicines and care for children with CAH around the world. CAH is the most common adrenal disorder in childhood, and improving care is not just a health issue, it's a matter of equity and human rights. Next slide. So the goal for Mates for Kids is to reduce preventable mortality associated with CAH by 30% by 2030. To achieve this, we focus on 3 core objectives, each designed to address a critical gap in the global response to CAH and other serious childhood non-communicable diseases. Next. So our first objective is ensuring that all children with CAH have reliable access to medicines and equipment they need to survive. Hydrocortisone and fludrocortisone are life-saving and listed on the WHO's essential medicines list for children, yet remain out of reach in many low and middle income countries. Inclusion in national essential medicines list and coverage through national insurance is critical. Newborn screening without treatment access is dangerous. Daily medication is essential to prevent adrenal crisis and save lives. Universal health coverage is key to making that care affordable and consistent. Next slide, please. Our second objective recognizes that access to medicine alone isn't enough. Children living with CAH, especially in under-resourced settings, face ongoing challenges that impact their quality of life. That's why investing in community development and support systems is so essential. Strong, connected CAH and NCD communities play a vital role in advocating for care, navigating health systems, and supporting one another. When we listen to and partner with these communities, we help ensure that services are relevant, respectful, and responsive. This slide shows a message sent from the Indonesian CAH team to the Colombian CAH team, offering their support for Colombia's inaugural CAH club meeting. It's a powerful reminder of how small and interconnected the world can be, and how CAH communities across borders and languages continue to stand in solidarity. Community-led co-designs initiatives are key to lasting impact. When young people, caregivers, and professionals work together, we build stronger systems of care that are rooted in local needs and lived experiences. Next slide, please. Our third objective is the global expansion of equitable newborn screening programs. Early detection saves lives, but only when paired with access to timely, effective treatment. To make NBS truly universal, governments must embed screening into their national development strategies and universal health coverage frameworks. This means not only investing in appropriate technologies and infrastructure, but also putting in place mechanisms for training, quality assurance, and accountability. Equity must be the foundation. Every child, regardless of where they are born, deserves the same chance at a healthy start of life. Next slide, please. So Mates for Kids places the global CAH community at the heart of collective action to strengthen collaboration and drive critical progress. Mates for Kids has established a multi-stakeholder community of practice that meets regularly through the World Health Organization's Knowledge Action Portal, CAP, and NCDs. The CAP is global online platform and knowledge hub focused on the prevention and control of non-communicable diseases. And Mates for Kids recognizes the 6 WHO regions of the world: the African region of the Americas, Eastern Mediterranean region, European region, Southeast Asia region, and the Western Pacific region. The Mates for Kids COPE brings together a diverse range of stakeholders and fosters collaboration across these 6 regions. This enables champions around the world to share successes, exchange knowledge, and scale up innovative solutions locally. Next slide, please. So as part of its commitment to community-led change, Mates for Kids aims to award 40 community development grants to CAH communities in low and middle income countries by 2030. So far, 11 grants have been awarded across 8 countries, supporting local efforts to improve access to CAH medicines, strengthen community networks, and expand newborn screening programs. Around 5 grants are now open and will close on May 20th. If you or someone in your network could benefit from funding to support a CAH community, we encourage you to learn more and apply. You can find more information in the chat. This initiative, beyond distributing grants, it's about building a connected, empowered global network with young people at its core, driving advocacy, collaboration, and sustainable change. Next. So one powerful example of youth engagement brought the Mates for Kids community development grants in is Angela Castro, who has already shared her incredible story with us today. We were introduced to Angela at Columbia's first CAH club meeting, made possible by one of the initial Mates for Kids community development grants. That experience brought together young people living with CAH for the first time, showing just how transformative community connection can be. With support from Dr. Paola Duran Ventura, a long-standing member of our community of practice, Angela went on to speak at several United Nations events. Most recently, she presented an English at her event at the 69th Commission on the Status of Women, reflecting her growth, courage, and unwavering leadership. Her journey is a clear example of how Mates for Kids grants don't just support programs, they support people. Every grant application asks, how will people living with CAH be involved? This ensures that youth are not only included, but actively shaping the solutions and systems that serve them. By putting young people at the center, regardless of the language they speak, Mates for Kids is building a truly inclusive and global movement. Next slide. Now I'm excited to share a special message from Samiha, a 23-year-old university student from Sri Lanka who is living a full and rewarding life with congenital adrenal hyperplasia, or CAH. In this video, Samiha offers a message for encouragement and support to other members of the CAH community in Sri Lanka, recorded ahead of their very first CAH club meeting. The meeting took place at the Faculty of Medicine at the University of Colombo in June 2024 and was a significant milestone in building community and connection for young people living with CAH. Samiha's story is a powerful reminder that with the right support and community, young people living with chronic conditions can thrive. I don't think we're able to hear the video.
Every one of us in this group has a unique journey, and while we face challenges in various ways, we also show immense courage in overcoming them. This sense of shared experience and mutual support has been a tremendous source of inspiration for me. It reminds me that I am not alone and that we all have the strength to rise above obstacles. Events like this CH awareness day are invaluable for many reasons. They are not only help raise awareness but about the condition, but also create a space for individuals like me to reflect on our journeys and feel more connected. Personally, this program has helped me better understand my own condition, improving both my physical and mental well-being. So it has given me clarity and strengthened my confidence to face life with a positive outlook. I hope that through this webinar and other awareness efforts, more people will come to understand CH and the importance of supporting those who live with it. Let us continue to share our stories, learn from one another, and inspire others to embrace their unique challenges with strength and determination. Thank you all for being part of this journey with me. Together we are stronger. Thank you again, Dr. Sundu, and the entire CH community for making this event positive. Stay strong and take care.
Okay, so in addition to the incredible boots on the ground work that young people are doing in their own communities, the Mates for Kids movement has embedded youth leadership at a structural level. One key example of this is at Mates for Kids project officer role, a position that has historically been held by university students. This role is absolutely vital. The project officer supports everything from the strategic marketing of the Mates for Kids movement to the behind-the-scenes project management of our community development grants. One of the major responsibilities for the project officer is managing at Mates for Kids presence on the WHO's Knowledge Action Portal for NCDs, or the CAP. This platform is where our community of practice lives. It's where we share resources, post updates, and promote upcoming events. Having youth lead this work reflects a growing global recognition. Young people aren't just the future of health advocacy, they're shaping it right now. The leadership of the CAP supports WHO's call for more meaningful youth engagement in health system strengthening and helps foster cross-generational collaboration across countries and sectors. The project officer also manages the life cycle of our grant program, setting timelines, tracking progress, organizing data, and supporting grantees throughout their journey. This work is especially important in countries where CAH is underdiagnosed or underreported, as it contributes to a clearer picture of CAH status globally. Beyond, the project officer keeps our website up to date, uploading new resources, grant announcements, stories from the community, and produces regular activity reports to track progress and guide our future efforts. Altogether, this role shows what's possible when young people are trusted with real responsibility. Through this leadership, they're not only supporting the global NCD movement, but they're building the skills and confidence to become the next generation of public health leaders.
All the stuff to do is closing that and adding this part, and then
honestly, they would say sometime.
Our event has now concluded. Though our event may be over, we ask that your involvement in NCD youth engagement does not stop here. What can you do to advance this cause? Will you promote dialogue on the power of youth advocacy in NCDs? Will you discuss implementation tech measures to improve youth access to larger advocacy platforms? Will you get involved in or support the work of organizations doing so? Will you express your concerns to policymakers to secure the role of youth in decision-making? What will your role be? To stay engaged, consider reading a collaborative publication on the power of youth engagement in NCD efforts, which will be released in late spring or early summer. Several of our speakers and organizations mentioned in this presentation will be involved. Please also keep an eye out for the UN high-level meeting on NCDs in December of 2025. This rare event will host NCD advocates from all over the globe, including some of our current presenters.
Thank you to everyone who has been involved for your support in the success of our first ECOSOC Youth Forum side event. Specifically, I'd like to thank CLAN's partners and presenters for volunteering to share the great contribution of youth in each of their NCD efforts. CLAN is unwaveringly grateful for the support of our community in allowing us to do the work that we do. We hope that your support will continue into the future so that we can continue our impactful work. A recording of today's event will be made available on CLAN's website. To stay up to date with CLAN's work, please subscribe to our newsletter or follow us on social media, where you can find us on most platforms. Our contact information is available on the slides now. Please don't hesitate to get in touch to learn more about the work that CLAN and Maze for Kids does. We look forward to what we can achieve when we utilize the power of youth in NCD efforts in order to leave no child behind. Thank you once again.